Joining us now to discuss this is Adrian Burrowes. Dr. Adrian, it's a pleasure to have you, sir. So a cap on insulin prices is included in President Biden's Build Back Better agenda. What would a price cap mean for folks who are insulin dependent?
I mean, that would be huge. And so what we're talking about is almost a third of all diabetics across this country, and there are 30 million diabetics, require insulin for treatment. I myself am a diabetic, and the prices for insulin are outrageous. For a medicine that's been around for a really long time, the prices should not be as high as they are. The prices are so high, in fact, that when I prescribe insulin to my patients, they have to make the choice between eating and taking the medication. And that shouldn't be. It is absolutely disgusting. And so this cap that he's proposing, which would cap it at $35 a month for patients, is very, very important.
Yeah, I mean, Doc, I'm not counting your pockets or anything, but I mean, you're a doctor, and even you said how expensive it is for you as someone who's dependent on insulin. What about the average American person and that's dealing with job loss due to the pandemic? How are they supposed to be able to afford this? I mean, it's gone up 47% according to GoodRx between 2014 and 2019. What's driving the price up?
What's driving the price up is greed. These manufacturers are making a different type of insulin, a newer type, which is very similar to the insulin that your body makes. And because of that, they have patents on these drugs, and they are just raising the price to the consumers just to try to line their pockets with money. Meanwhile, the average patient, as you state, can't afford the insulin. And so what happens is, especially in the African American population, that is, 4 times more likely to be diagnosed with diabetes, 3 times more likely to have complications from diabetes, including blindness, amputations, death, heart disease, things like this. These people are suffering because they can't afford the medications. And so, it's about time that someone intervenes, and I'm glad the government is looking at that now finally.
Yeah, well, speaking of that, what changes would you like to see to prevent another spike in prices? Because that's just ridiculous.
Well, absolutely, and the government needs to intervene. This particular product needs to be affordable and available. Thankfully, companies like Walmart have made some generic versions very available. These are not necessarily the best types of insulin, but at least it's an option for patients to have. But this needs to be capped, and this is not the only medication. There should be other caps for other types of medications as well. But insulin specifically, because it's so expensive now, so insanely expensive, this cap is definitely necessary.
Yeah, Doc, I want to ask you one last question, sir. What do you tell your patients who can't afford insulin? I know you mentioned that you help them look for alternatives, right, in terms of locations. But what do you tell them when they say, listen, Doc, I only got a certain amount of money this month for medication?
Yeah, and it's a very difficult thing for not only the patients, but me as a healthcare provider to try to figure out how we can make the patient make it last, make it work. We use these regimens that are not ideal just to try to help the patient get through. We have sent them to community programs trying to get them free insulin. Like I said, Walmart has been a very strong advocate for the insulin prices. But it is very, very difficult as a provider when you have a patient who can't afford the medication to deliver proper health care when you have these companies driving the costs up.
Yeah, makes your job a whole lot harder, I'm sure, Doc. Doc, thank you for stopping by to talk with us. We really appreciate it.